Should you take the Wegovy high dose if you're already on regular Wegovy? Hi, I'm Dr. Wong. I'm an obesity medicine physician and weight loss coach, helping you cut through the pseudoscience and confusion in weight care. My approach combines evidence-based medicine with real behavioral change. So you don't just take medication, you actually transform your health. So you're on regular Wegovy 2.4 and you're wondering, this high-dose Wegovy is out now, should I move up to that? Well, let me walk you through the clinical reasoning I use when evaluating a patient for that transition. I've put together other videos about high-dose Wegovy if you want all the details. I'll leave those linked in the description box below. Let's say you're on regular Wegovy 2.4 and you've been hearing all about this high-dose version, and you're asking yourself, is this the right move for me? Should I bring this up with my doctor?
The first thing I'd want is for someone to have spent a solid amount of time on Wegovy 2.4s before we start talking about stepping up to 7.2, because a lot of people, just because you've reached the maximum dose doesn't mean your weight loss is done. For some patients, once they hit that ceiling, they continue losing for months and months afterward. So I really want to be evaluating them once their weight has found, I don't love using the word plateau, once it's reached its new normal level. For most people, that's going to be around 3 months at the 2.4 dose, where the pace of weight loss has clearly slowed, like it was coming down steadily, and now it's starting to level off. I really don't want to bump someone up if they're still losing 1, 2, even 3 pounds a week. I don't want to overshoot, especially at a higher dose. There's a greater risk of side effects, and it's just not worth pushing someone up if we might have to bring them back down. You'd be putting them through more side effects for no good reason. I want to have a clear sense of what the 2.4 is actually going to get them to before we make any moves. I would definitely consider this for a patient who's been on Wegovy 2.4 for a while and just hasn't had the response I was hoping for. Maybe they've lost 9 to 10% of their total body weight, but haven't gotten closer to that 14 to 15% range. Or maybe they have a significant amount of weight to lose overall. Maybe they've gone from a BMI of 36 down to 31, but our target is getting them under 30. That's someone I'd seriously consider high-dose Wegovy for, especially for patients who, when I first meet them, are right on the edge of the conversation about bariatric surgery. Most people want to try medication before going that route, and that's completely understandable. But for a lot of those patients, Wegovy 2.4 might not get them all the way there. High-dose Wegovy might be exactly what closes that gap for them.
This is also something I pursue with patients who've tolerated Wegovy well throughout. Everyone's different, but if someone had a really hard time titrating up, that's not who I'm going to be eager to take to 7.2. There are more GI side effects at that level, and subjects in the research have reported skin discomfort sensations as well. So if someone really struggled and is now stable at 2.4, it's always a patient-physician conversation, but I'm going to feel less enthusiastic about that particular person compared to, say, the many patients I have who lose weight without much trouble at all. For those people, the discussion about expectations and side effect risk is much simpler. Not that side effects can't happen, but the likelihood is lower. There's also the mindset factor. Some patients come in and tell me, I want the medication that's been out for years, the one with a large body of research behind it. I don't want something that just launched.
I don't want to be a test case, and if that's you, this probably isn't the right time. You might want to wait a year or 2 before trying it. But I also have patients who are completely the opposite. They're excited about something new. They do well with medications. They're not sensitive to them. That's a much easier conversation when it comes to moving up. before I take anyone up to the higher dose, I also want to make sure the lifestyle side of things is genuinely dialed in. Eating habits, exercise, all the behavioral changes we've been working on. I want to see that they're consistent and feeling good about where they are with that. And if that's something you'd like help with, the link is in the description. I work with people as a weight loss coach to help them optimize their eating, build consistent exercise habits, and do everything that helps the medication perform its best. If that's a gap for you right now, click that link below and I'll walk you through how I support people just like you. But yes, getting the lifestyle foundation solid before making that jump is really important, because we may not need to go higher at all. And honestly, who doesn't feel better when their eating is on track and they're moving their body the way they want to? There's just no scenario where that doesn't help. And of course, if someone is already on a weight-promoting medication, or they're starting one or increasing their dose, that's also someone where high-dose Wegovy might make a real difference. Fighting fire with fire at the highest level we have available. So if you're currently on high-dose Wegovy, how's it going? I genuinely want to hear your experience. Drop it in the comments. And if you're considering it, did any of this resonate with you? Let me know below. Thanks so much for watching. And again, if you'd like to explore working with me one-on-one, click the link in the description. Thank you, and please take good care of yourself.